What we want to do this afternoon is talk about employment conversations that you might be having with individuals. Again, my name is Lisa Brown, and I am the NYESS Assistant Director. This afternoon, I want to open it up for questions as well. So as we go through the process, I will pause and ask if you have any questions. Feel free to unmute yourself or raise your hand or put information in the chat. We'll try and maneuver through this during that, using that process. I want it to be interactive. I want to answer questions if you have any on this important topic. To get started, we want to talk about the people that you're serving and helping them get back to work or get to work. And so we developed this Employment 101 for housing so that you have some questions or conversations to fall back on to help individuals that you're serving. So these are some of the conversations we're going to have today. We'll talk about NYESS. Again, that's where I work, what it is and how we can help you. We'll talk about the emphasis on employment for OMH Housing. We'll talk briefly about employment and the things that you need to know about it, why it's a good idea to encourage people to go to work. We'll also touch on developing a strong work ethic. So, sometimes we take it for granted. We don't realize how we've developed a work ethic and how we use that in our day-to-day basis. But as you're working with individuals who are going to work, that's a really important conversation to have. We'll also talk about benefits basics, and any individual that you're working with who is on any type of public benefit should be connected to what's called a certified benefits advisor. And that person can help them navigate how working is going to impact their benefits. And we'll talk a lot about that today. We also want to cover IPS, and that is a supported employment model to help people get back to work. We want to talk about what it is and how we can do it, how you can incorporate those principles within the work that you already do. And then there's a few slides of resources, things that are available to you to help you with your day-to-day in incorporating conversations about employment. So let's jump right in. NYESS, the New York Employment Services System. So people wonder, what do you do? What is this about? And it's a statewide partnership and a resource for all things related to employment for both providers and participants. There are over 200 NYESS provider affiliates. That means providers who are associated with the Ticket to Work program as well. And we work with all state agency affiliation types, all program and funding models. And we're a unique partnership that not only includes all state disability agencies and community partners, but also workforce, like the Department of Labor, New York State Department of Labor. So on this slide, you will see our New York Employment Services System logo at the top, and all of these are our state partners. We work very closely with them to help give them information and resources on employment and help them spread the word about employment. An interesting thing is that a long time ago, the New York State Department of Labor and the Office of Mental Health came together and decided that there was a gap in resources available for the state of New York on employment. And so the New York Employment Services System was born, and that has been our focus. Our primary focus is getting the word out about employment and various resources associated with it to anybody that we can. So as I mentioned, NYESS is a statewide partnership. We're also a collaborative employment services case management system. So we have a database of information that we allow employment service staff to enter data into that system. We're one of the largest Ticket to Work administrative employment networks across the United States, and we're a primary employment services data source. So as people are looking for data on people with disabilities and getting jobs and services that they need, we can help provide that information. But overall, all of those things that we do our primary focus is still being a resource for all things related to employment. So I want to offer that if you have any questions or you need resources for employment, please feel free to reach out to me, and we as a team would be happy to get that information to you. So one of the questions is, how can we help? So not only can we help you get resources or information about employment, but it's important to know that we can be a comprehensive resource. So there are a lot of different things out there in the world that you might need information about. So certified benefits advisors is one of those resources. Other data like documents on employment or the Ticket to Work program or Social Security information. We would be happy to help with any of those topics, and training and technical assistance is always available. Any questions about NYESS or how we can help you? Okay, then let's talk about employment conversations. So in working with the individuals that you're serving, there are a lot of things that come up. There are a lot of needs. There are a lot of goals and plans and processes that people have to go through. And one of the things that should come up during these conversations is employment. And so sometimes we're asked, well, when should we start those employment conversations? And honestly, during the initial OMH housing process, that's when the beginning employment conversations should begin. Just talking about what are their goals and how can they, what do they see in the future? What would they like to do? Employment might be one of those conversations that comes up. And they can begin early on and are not really reliant on the person's readiness to go to work today. Like they don't have to be ready today to go to work, but they're interested. So we should begin those conversations, and those conversations can have a lot of topics involved, and we'll talk about some of those today. Even when the individual needs acute management of symptoms, employment conversations are still appropriate. So again, even if they may not seem like they're ready to walk out the door and get a job tomorrow, the planning process, the conversations are still very important, even at those very early stages. In fact, upon admission, housing providers should be asking residents, what is it that you'd like to work on? What kind of goals do you have for yourself? And then narrow that down to what are your interests? Have you ever thought about working? And if you have worked in the past, what was good? What was bad? What should we work on better? And then are you interested in working or exploring other options? So sometimes supported education is an option. And so we have to make sure that we're looking at the big picture. What is it that interests that person? And what other options are out there for the individual? One of those things that comes up is, how do we begin these conversations? Where's a good starting point? And so it's important to talk about the benefits of going to work and focus on the path to individual financial self-sufficiency. And we'll talk a little bit more about what are the specific benefits of work, but sometimes people haven't heard that. You know, it's important. We all have bad days at work sometimes, but overall, the benefits of working are really considered what people call a social determinant of health. And it's really important for those individuals to go to work. It's also important to talk about basic information about working while receiving public benefits. And one of the ways that you can do that is just be more knowledgeable about benefits in general, but also refer someone to a certified benefits advisor who can actually walk through what happens when somebody goes to work, what happens to their benefits. In addition, providing employment resources for individuals. There's a lot of information out there about people who are on Social Security benefits and they want to go to work. Well, there are things called work incentives that can help people hang on to their benefits longer while they try working to see how that works for them. So resources like information on Social Security work incentives. We also want to provide concrete examples of success and ask what success means to them. So in all of our lives, everybody who's on this presentation right now, we all have different views of what success might mean for yourself. And so it's really important to get an idea of what that person is thinking about for success. What do they need to accomplish? And then also talking about the individual's goals and their dreams and their plans for the future. Sometimes people don't make goals. I have friends, personal friends, who don't do that. I make all kinds of goals and plans and dreams about the future. And so that might be something to talk about to help somebody develop goals and dreams and plans. As I mentioned, success can look very different for every individual. And so when you're working with someone, it's important to know what success means to them. And so it could just be getting a job, just getting out there, getting a job, whether it's full-time or part-time, and trying to work. That might be the whole goal. Maintaining a job, maybe the success is hanging on to the job that they've had for a year or 2 years. It might be attending school. As I said, supported education might be an option for someone. And maybe they could get a high school diploma or a GED, attend vocational school, community college, or graduate school. They may also take a look at, vocational programs or internships, apprenticeships. Those are all possible options. Sometimes people want to work and maintain all of their Social Security benefits, and that means success for them. And sometimes people want to work off all of their Social Security benefits and other public benefits. And so it's important to get a big picture of what success would mean to that individual. And one of the things that comes up from time to time is I have no idea what I want to do. I don't know what type of work I want to do or where I want to go or how to get started thinking about that. And so some of the things that might come up would be something called an interest inventory. And I put a link in here for onet.org. It's onetonline.org. But they have an interest inventory that is, a questionnaire, 60 questions on a variety of scales, what they like best, what they don't like. It's really important to know even what they don't like to do, because that could make a big difference in where they go next. Also discussing those interest goals and plans, discussing the differences between part-time and full-time. Sometimes a 37-hour work week is considered full-time. It doesn't have to be 40 hours. So it's important to kind of look at that, figure out what they mean, what works for their schedule. Is 10 hours best, 20 hours, whatever works. Discussing internships and apprenticeships. That's really important. And volunteerism. So an individual, especially who doesn't have a work history, could start out with volunteerism and maybe learn various skills on the job that they're volunteering at, or even just doing volunteerism to figure out what they like. Maybe they like to do this or like to do something else. And it gives them a little bit of experience and additional skills, and it gives them a clearer picture of what they want to do. And then in the process of determining what kind of job a person wants to do, it's important to figure out what kind of education level is the best. Are they okay? Do they have all the education that they need in order to step into that job? Or are they going to need an additional diploma or a certification in some area or a specific degree? Do they have to go back to school and get that degree? And then discussing the previous employment failures and successes. So it's important to know if they worked before, what didn't work? What was it that did not work for them, and how can we fix that? And what did work for them? What was a success, and what they did to make it successful? And so using that information together can help determine, all of this information can help determine what they're going to try to do next, what their plan is, what kind of job they would like to do in the future. Okay, I am going to stop sharing for a moment because I did see that there was something in the chat. Does NYESS come to various locations to speak with clients, or do you only support the agency workers? And that's a great question. We primarily work with provider staff, so agency staff. However, we also have done presentations, like benefits presentations for people who get benefits, SSA benefits, their families, staff. Everyone is invited to those types of presentations. So if you have something specific that you would like to consider, please reach out and let me know, and we may be able to support that for you. Any other questions while I'm not presenting? Okay. Well, then let's talk about service plans. So as I recall, this is something that you guys are very familiar with, service plans. So service planning, employment conversations can even come up in this process of service planning. So during the process, you're developing the service plan and completing the functional assessment. And every restorative service could support a work goal or employment exploration. And so I have a few examples for you. Medication management. So if you are completing a plan that says this person is going to be taking medications at work, there are some things to consider. Discuss how to arrange that and how to maintain privacy. So a person may not want to take their medications at their desk. They may, go to the restroom and take their medications. But they want to maintain privacy to do that. They don't need the whole office knowing that they're taking medications. You also might discuss work schedules that are based on the medications being taken and any side effects. So for example, if a person takes their medicine late at night before they go to bed, and then they wake up really groggy because of the side effect of the medication, then they might consider starting later in the morning, taking a 9-to-5 job or even a second shift job, thinking about how those medications and the side effects of those medications can be handled. In addition, you might think about arranging the work schedule based on attending various medical appointments. If you know that you're going to have to attend a weekly appointment or every other week, you might consider thinking about a different type of schedule, maybe requiring Thursdays off every week because you have to go to the doctor on a Thursday. In addition, if you're working on a plan that includes daily living skills, you might also consider budgeting, like income and benefits, or transportation costs, things that they need to budget for, work clothes, transportation costs, childcare expenses, medication expenses, and kind of considering all of those things in this daily living skill. Also, you might consider including preparation for work in terms of making sure that they're showering, they have clean clothes, getting up and getting ready on time, making those plans in their schedule to do those things, and discuss reporting their earnings to Social Security. So individuals who are getting SSI or SSDI benefits should report their income every month. And so figuring out how to help that person report that income. If you're working on socialization, you might also include appropriate socialization at work. So how to set appropriate boundaries with coworkers, or the hierarchy of having a supervisor. What is the process? In addition, discussing appropriate sharing of personal information. How much is too much information to share? Also discussing appropriate interactions with customers and the public. So making sure the customer service skills are in place and discussing how that is impacting in the workplace. You might also be considering community integration. And as you're doing that, you're discussing maybe how individuals will get to work. Maybe they're taking the bus, the train, or the subway, and their understanding of schedules and routes. It's, I've recently been to New York City and the subway system, and it's not crystal clear the first couple of times that you're there. So learning how to get where you need to go is really important, and especially if you're going to work, trying to figure out how to get there. Discussing the individual's knowledge of employment opportunities within their community, and discussing what employment resources are available within their community and how to access those resources. In addition, if you're looking at symptom management, you might discuss how the individual will manage their symptoms at work, recognizing that they might be struggling and what to do about it when that happens, putting a system in place to take care of that. Discussing the possibility of having a job coach and how to reach them, and discuss how to manage the stress of working. So there's a lot of things to consider, especially when you're service planning, putting together a functional assessment, figuring out how to support this individual who is going to work that you're working with. Okay, I did see a couple other questions, so I will check this out. Is reporting income something the person has to do if they are in the Ticket to Work program? So, Jennifer, if a person is getting any Social Security benefits at all, SSI or SSDI, they are required to report their income. It's not reliant on them being in the Ticket to Work program, but if they are in the Ticket to Work program, yes, they should be reporting their income as well. Does NYESS provide job coaches or coaching? Great question. And we do not. We are an agency with resources, employment-related resources, and we have providers who provide employment services, and they would have the job coaching. And if you need a connection to someone, let me know. We would be happy to connect you with someone who could do job coaching. Okay. So the next topic is advocacy. And so one of the things that we find is that in our employment conversations, we, me or you as the housing staff, may have to be the advocate for their residents. So a person who wants to go to work and they come to you and you're having this employment conversation about work, they may say, my PROS program is not going to allow me to go to work, or they're not going to support me at work until I have better attendance in their program. Or maybe AOT indicates the individual is not ready to go to work. Or the treatment team in general may indicate that the individual is not really stable, or point out that the last time they tried to go to work, they were unsuccessful. In addition, family and friends may not support the individual because they're concerned about them losing their benefits. Substance abuse providers may be worried about a relapse, and medical providers may claim that it's too stressful for an individual to go to work. So you may find yourself advocating for someone in one of these scenarios and say to the treatment team, you know, I think we ought to try this. We've had this employment conversation, and this is what they want to do, and this is how we're going to support them. And the team itself can come together to support the individual. But you may be the person who has to advocate for that individual. In addition, additional, employment conversations include people who are going to work are awfully concerned about losing their health care. They're concerned about losing their benefits, and they're really concerned about losing their housing. And so as you talk with people, it's important to emphasize with them what will happen to their housing benefits. So as we know, it depends on the housing type. SSI cash benefits may change. The personal needs allowance may change. The amount of rent to pay may also change, even though it might still be 30% of their income. And the cost of the housing fee won't change no matter how much an individual will earn in wages. But it's important to emphasize the connection with going to work and housing. There's a lot of different housing types out there. So when you're talking about individuals about their housing, it's important to know and reassure them that in these cases, maybe nothing will change, but there may be a few changes. So kind of looking at their specific housing type and connecting them with the information they need. It's also important when we're talking about going to work that somebody who's never worked before may need just basic information about what working means. Maybe the appropriate use of language in the workplace. It might be okay to say, inappropriate words if you're working on a construction crew, but it is not okay to say bad words when you're working in an office setting. So it's kind of important to know where you're at and what appropriate language is appropriate. It's also appropriate to know what dress code works. So again, if we're working on a construction crew, you have to use, jeans and a t-shirt and steel-toed shoes maybe. But if you're working in an office setting, you're going to need to dress like business casual. So it's important to know the differences about where they want to work and what that means for different clothing types. Someone may not have ever worked with a supervisor before, and so they may not understand the role of the supervisor and how they impact with that individual. So kind of learning about that process, the hierarchy within the office setting. There are also some specific workplace norms that just happen, and people in the job know what those are, but someone who's never worked before may struggle to understand those things. The relationship with coworkers. So as I mentioned in a few earlier slides, learning what boundaries to set with a coworker, or learning how much personal information should be shared at work with a coworker. So kind of developing those relationships and knowing how those work. And then general office rules. So just understanding you have to be on time every day when you go to work. If the water is low on the Keurig machine, you have to fill it up after you've used it. Just basic general office rules. And then work ethic. So that's another one of those areas that we really want to stress is it's important to have a good work ethic at work versus a poor work ethic. And we're going to talk about the differences between those. Any questions at this point? Okay. Then I think it's important to talk about employment myths. So as I mentioned, people are really concerned about going to work and they have some specific fears. And so let's talk about those. So traditionally, it takes a long time to get SSI and or SSDI benefits and other public benefits. So individuals are sometimes anxious about going to work with the possibility of losing those benefits because then you have to start all over again. Additionally, family and friends have heard rumors about people who go to work and then they lose their benefits. And they're wary about encouraging an individual to pursue employment. So they don't want to go to work because if my son goes to work, he's no longer going to get his benefit, and that's going to impact our financial budget. So it's really important that we talk about these myths and we let people know what the truth is about them. So here are some common myths. I can only work 20 hours a week to keep my benefits. I have a disability, so I can't go to work. I can't work until I'm considered stable by my psychiatrist. Or if I go to work, I'm going to lose my Medicaid benefits. So let's take a look at each one of those. So the facts are a certified benefits advisor can provide clarity for an individual's specific situation because there are several variables associated with keeping Social Security benefits and going to work. And it's not all about the hours. So hours is definitely a piece of it, but there's the hourly wage a person earns. And there are various work incentives that an individual may be eligible for. And if they can take advantage of those, the number of hours may have very little impact. So again, anybody who is on any public benefit, not just Social Security, should have a connection with a certified benefits advisor. And if you're looking for one in your area, NYESS on our website, and we'll talk about that in a little bit, but we have a locator map. So you can go to our website and click on the locator map, put in your zip code, and you could find a benefits advisor there in your area. We also want to take a look at the next myth. SSA recognizes that individuals who receive SSA benefits can actually work. And because of that, they've created the Ticket to Work program to encourage individuals toward financial self-sufficiency. So Social Security knows that people who are on disability benefits absolutely can work. And they created this Ticket to Work program to help create kind of a safety net for people to try to go to work and see how that works for them. So it's just a myth that people who have disabilities can't work. It's also important to think about avoiding the disability mindset of long-term dependence on benefits, and that the individuals have to be considered ready or stable or even compliant in order to go to work. And that is simply not true. People who are homeless, people who are managing critical symptoms, mental health symptoms, they can still go to work. They can get a job and they can go to work and maintain that employment, but they need supports to help them in whatever way is appropriate for them. But having support on the job or helping them get the supports they need can help them maintain that employment. So it's important to think about options and not just black and white, whether or not they have to be on benefits or off of benefits in working. In addition, there are ways to keep Medicaid. So healthcare coverage is a big deal for people, and they don't want to go to work and lose that healthcare. And so there are ways for people to be able to maintain Medicaid coverage as long as they possibly can. And there's two programs. One is the Medicaid 1619B rule that allows an individual to work and earn money and still maintain the Medicaid. And then there's the Medicaid buy-in for working people with disabilities. And that also allows individuals to earn even more money than 1619B does and maintain that Medicaid coverage. So we can talk about that in more detail if you'd like to further on. Even if some of the SSI cash benefit is reduced, so let's say a person is getting SSI benefits and they go to work and their cash benefit is reduced because of their income, the individual still may have a better overall financial picture, and they are able to maintain their healthcare benefits in most cases, including Medicaid and Medicare benefits. So it's important to kind of stress that, and connecting someone with a certified benefits advisor can help that person better understand that process, and they'll have someone on their side to help them work through that so they can understand how that happens. Again, a benefits advisor provides information to a person about benefits, but they also get specific Social Security tools, like what's called an SSI calculator, to help somebody calculate how much their income and their benefit will be based on them going to work at a certain amount. The BPQY is called a benefits planning query, and that is a document from Social Security that can help somebody understand what benefits are currently being received and the healthcare coverage behind that. And work incentives. So a benefits advisor can lay out all of the work incentives that are available to that person and see if they qualify or if they're eligible in any of those ways to help that person maintain their benefit as long as they possibly can. Okay, and I did see some questions in the chat pop up. So let me scroll through here. Okay, let's see. So there were a couple of questions related to job coaching. So yes, if you need a connection for job coaching, please reach out to me and I can connect you with someone who is in your area. Okay, and then please let people know that the Alliance for Rights and Recovery will go to sites and offer training on many of these topics to people who are interested in going to work. So yes, thank you, Pat, for mentioning that. The Alliance for Rights and Recovery, they do a lot of training and provide a lot of information about resources for employment as well. So please utilize them. If one is in the Ticket to Work program, should their SSI be garnished from that income? I'm not sure exactly what you're meaning, Jennifer, by that, but if somebody is in the Ticket to Work program and they are working, their income is going to be counted toward whether or not they're getting additional SSI money as well. And so if they earn more and they lose their SSI benefit, that's a possibility. I'm not sure, I can't come up with a scenario in where an individual's SSI would be garnished, but it is possible if there was an overpayment. So if they received an SSI overpayment, they may have to pay that back. And Social Security takes out a certain amount, a percentage, based on how much they would owe back. And Jennifer, if you have additional questions on that and you want to reach out personally, I'd be happy to help you with that. Okay. Many people experience a decrease in their benefits after reporting jobs. Yes, if an individual is receiving SSDI benefits, they have what's called a trial work period, which is 9 months to earn as much money as they want without it impacting their benefits. But once they go past that 9 months, then it may impact their benefit. There are specific scenarios that we could talk about in greater detail. If they're getting SSI benefits, yes, if they go to work, then their benefit, SSI, may be reduced based on their income. But if they are eligible for any of those work incentives I mentioned, then they may be able to maintain that benefit longer and would not just lose it altogether. So there are specific information about benefits that a certified benefits advisor could help them understand. Benefits advisors, if you go to our website, it's NYESS, NYESS.ny.gov. On our homepage, there is a link that says Benefits Advisors. If you click there, that goes to the locator map, and you would just put in your zip code, and you could find one in your area. If you're having trouble finding one in your area, reach out to me, and I will help you locate somebody. Additionally, I want to mention here that through the New York State Department of Labor, there are people called Disability Resource Coordinators in upstate New York, and in the city, they're called program managers. And the majority of those individuals are certified benefits advisors. And if you want connected to one of those, also, please let me know. There is no cost for someone, especially if they're using a DRC or program manager for the benefits counseling. BPQY stands for Benefits Planning Query, and that's a document that someone would get from Social Security. Typically, the benefits advisor would get that document to help put together a benefits plan for the individual that they're serving. So it's not something that just any of us would go and get because we wouldn't have any use for it, but a benefits advisor would certainly do that so they can put together a whole plan for that individual. Okay. In addition, so the Alliance for Rights and Recovery, as I mentioned, is a resource for employment and training. Rob Stratham, and you can see his message in the chat box. He says that you can contact me for additional employment training for staff, and he left his email in the chat. So if you want to connect with him, he can get you connected with some specific training. Work is a therapeutic intervention for people with mental health challenges. Yes, as I briefly mentioned, it is about knowing the benefits of going to work and talking to people about those social determinants of health, and work being one of those social determinants of health. If you're working, you have better overall, a better quality of life, better health, and it is a therapeutic intervention. Let's see. State Department of Vocational Rehab. Absolutely. Thanks for bringing that up, Danette. So in the process of finding support for someone to go to work, State Vocational Rehabilitation, and in New York, it's called Access VR. They are also a great resource. So you can get someone referred to them. You just contact them, complete an application, get them set up with Access VR. And then in the course of that process, they can help them with employment services, or they can also help them with educational experiences. So they can do either or. They also offer additional services somebody might need, like vehicle modification if they needed hand controls on their vehicle or something. So they do a lot of other things besides education and employment, but that would be a great resource. In addition, they have vendors that provide that service, so they would also be able to connect that person with a certified benefits advisor as well. So that is another great option. Thank you, Danette, for mentioning that. Okay, any other questions before we continue? Okay, so let me get this back up. Okay, so now we're going to talk about what you need to know about employment. So when we're talking with people about employment, it's really important to talk about those things. And we just talked about social determinants of health. So here's where we're going to delve deeper into that. So a lack of employment is a key social determinant of health, just like poverty is. And both lead to poor health outcomes. So it's important to know that low employment rates are pervasive for individuals with behavioral health disorders, and the effects are more significant than that of their non-disabled unemployed peers. So that's important to know. And what will improve outcomes is the weaving of employment principles and practices into day-to-day service delivery. We need to resist the tendency to leave employment discussions for vocational only programs. So it's important for all of us, whatever industry you're in, to talk about employment and to let people know about those positive aspects of employment. If we're providing rehab supports, we must also incorporate those employment conversations. So here's where we talk more about how it's a social determinant of health. If you're going to work, you're having a better financial health picture. Your physical and mental health is better. There's also a positive recovery from substance use disorders. It increases a person's socialization, gives them a meaningful activity, increases their self-worth and work ethic, and just overall gives them an improved quality of life. So as I mentioned, sometimes we have bad days at work, but overall, going to work is good for us to do that. It also can show a reduction in the need for medical and behavioral health interventions, as Rob stated in the chat. We do have to be careful about our own biases. So things that you know or that you think you know about people and going to work while they're experiencing psychiatric or substance use barriers, we have to know, is that a sound foundation? And we have to leave our biases at the door when we start talking to people about going to work, regardless of their diagnosis and regardless of, what's happening in that person's life. So it's just really important to not think about what we think we know and actually get the facts and share that information with the individual. So working while receiving public benefits is a good idea. Those providing supports do not need to be benefits experts, but they do need to understand a couple of basics. So individuals will have more money in their pocket, and they will not be penalized for working while they receive Social Security benefits, but they have to report their income every month. And it's important to know that and stress that with individuals. Individuals will be eligible for free Medicaid in almost all scenarios. Again, I mentioned 1619B and Medicaid buy-in. And the common frustrations associated with public benefits are real, and they need to be a part of that employment conversation. And when I say that, that's not just Social Security. Every social service agency has their own eligibility criteria, and it gets very frustrating for people to understand, if I do this, I might lose that, but how can I do this and not lose that? You know what I mean? So it's really important to talk about those things up front so that everybody's aware. In addition, there are a lot of myths about what happens when somebody on public benefits goes to work and they earn some wages, and they're not real. And those also should be part of that employment conversation. So we went through the myths and the facts section. This is a good area to include in any employment conversation. so that people know what the facts are about going to work. So benefits advisement, again, this is like my 5-minute commercial during this process today, but it's so important for people who are on benefits to get connected to someone who is a certified benefits advisor. Each situation is different. Even if they're all on Social Security disability, they may have different financial pictures or backgrounds, and it's important that everyone be connected to a certified benefits advisor. And if you don't have a go-to benefits advisor, let me know. Reach out to us. We'll help you figure it out. And if you don't have a website to go to about benefits, also let me know. We can help you get connected to websites that will tell you that information. We have on our website, we have a customer resources page, and it is about benefits for someone. It's about work incentives, Social Security benefits, and a variety of tools that can be used. There's also the Ticket to Work website, which is choosework.ssa.gov. And that website is primarily about Ticket to Work, but it talks about benefits and work incentives that are available as well. Any questions so far? Okay, we're going to change our focus just a little bit and talk about individual placement and support, IPS. This is a model for supported employment. So let's take a look at this a little bit deeper. It is an evidence-based supported employment model for people experiencing behavioral health disorders. The model of choice that provides the foundation for how we engage with and support participants' employment services. And there are 8 simple but fundamental principles. And additional required trainings are available through Center for Practice Innovations, and they offer more in-depth training specifically on IPS if you'd like to check that out. The focus of this model is on rapid engagement and ongoing person-centered support to achieve the goals that are related to their employment. So one of the things that's important to know about IPS when we say evidence-based supported employment model, evidence-based means that it's been proven to be true. It's been proven to work for people. Evidence-based, there's been testing going on to figure out if this is a good, viable model, and it is. And so it is the model that not only OMH, but our state focuses on in the use of our programs, our OMH programs and other state agency programs. And the focus is on the IPS model. And these are the 8 simple principles. So the first one on this list, they're not in any specific order, but the first on the list is focusing on competitive employment. And that means the individual is going to work in a place that hires people who are disabled and who are not disabled. It's competitive. Anybody can work there. A long time ago in a land far away, there were places where people were employed who were just disabled. And those were called sheltered workshops, among other things. But what this plan focuses on is working side by side with people who are or are not disabled. And that's huge. The next one says eligibility is based on client choice. The individual says, I want to go to work and this is where I want to work. This is what I want to do. This is who I want to be. This is my preference. So it's based on the client choice. Integration of rehab and mental health services. So it's like a team approach. It's the rehab of employment, going to work, finding a job, getting employed, and maintaining employment, but working in conjunction with, integration with their mental health services that they're currently involved in. In addition, attention to worker preferences, making sure that the individual identifies what it is they want to do, where they want to be, where they want to go, and us as the staff person helping support that. That is the focus. Also, personalized benefits counseling. Again, somebody who is a certified benefits advisor can assist an individual in that way. Rapid job search. This means as soon as that person starts talking about going to work, that the process is started, that staff are reaching out to various businesses in the area or looking at various options for that individual. And there's a systematic job development process in place. There is a specific guidelines, specific route that a person takes, the staff takes to help that person find a job systematically. And it's time unlimited and individualized. So individualized just means whatever that person needs. It's not a set of things that everybody gets. It's just what that person needs. And time unlimited means if they come back a year from now, they can still get support. They can still get that information. So it's time unlimited. It's a really important process. And oftentimes we do these things without calling it IPS. Like we just automatically focus on competitive employment and we automatically help people get to benefits counseling. And we just automatically, systematically have a job development process. But so you may already be familiar with these things, you just may not call them IPS at this point. But IPS does not mean each program model must provide the full range of support, dependent on the program policy and funding restrictions. So there may be an agency that can do 6 of these 8 things, but they can't do the other 2. They're not set up for it. They don't have funding for it. So that means that they would work in conjunction with another person, another agency, maybe a referral to that other agency to help get those other 2 services in place for this person. So it does mean that if your program can't provide the full support, that you have to be a connector. Allow for rapid engagement, connection for both staff and participants. Map out the existing resources, both internal and external, and then establish that collaborative relationship to cultivate the necessary network. So you're all at the same table and you're working together to figure out who's going to do which of these services, and who will do the other set of services. And again, you don't need to be an expert, but you should know who the experts are, being connected to other people. And this is the expectation for PSR providers and not simply a recommended best practice. So it's really important to understand what IPS is and acknowledge that maybe you can do these pieces of the puzzle, but you're not able to do the others, and then find someone who can. Connect with them to get the full line of services for someone. Okay, I did see some conversation. So Kathleen, if you want to touch base with me later, I'd be happy to talk to you about that. You could send me an email or leave me a voicemail. Yes, these slides are going to be shared after this training is over. And would a referral to Access VR count as IPS? So if you can provide pieces of the services that are being provided and Access VR can provide those other services, absolutely yes. They can be a connector, a collaborator with this set of IPS principles. Great, thank you, Erica. Okay, any other questions before we move ahead? Okay. Get rid of this picture here. There we go. Okay. So the next thing that we want to talk about is helping someone develop a work ethic. And one of the things that comes out of this sometimes is, well, what actually is clarified as a work ethic? What does that mean exactly? So work ethic in general is the principle that hard work is naturally good. And we have a strong work ethic because we have learned or developed good work skills. And these skills include our behaviors, our attitudes, our motivations, and our commitment. So the thing about work ethic is we can develop a good work ethic and good skills, or we can develop a poor work ethic and poor skills. And the thing about that is that it is a learned process. So oftentimes people are providing, uh, you know, the information. We're just observing what's happening and we're learning, picking up from what we've observed. And so if we are observing someone who is providing poor work skills, then that's what we're going to learn. And that's what we will develop over time. So it's important to know how we developed our own work skills as well. This is a topic that is often missed when we discuss employment and rehab with people, regardless if they have a disability. So this is an important topic for anybody entering the workforce. It is not just related to people with disabilities, it is for everybody. And so as we start talking about work ethic, it's important to consider our own personal work ethic as well. But we forget to or fail to recognize that work ethic is developed through our family, our social environment, or our educational and early work experiences. And it often occurs without us really noticing that it's happening. So it's really important to kind of take stock into, who did I observe this work skill? And am I doing a good work ethic or a poor work ethic? What does that look like? So because it's a learned quality and it's developed through trial and error and observation, it's really important that we consider the result and the practiced habits that we now have based on what we've learned in the past. So when we talk about developing a work ethic, there are some very specific core components of a work ethic, and they can be challenging for people, not only people with mental illness, but people of any background, regardless of disability. And so we want to talk a little bit about those today. So we're talking about self-motivation. So if you're thinking about an individual, are some of these concepts challenging for them? A self-motivation, self-confidence, maybe the ability to accept direct criticism. Maybe a supervisor is reviewing their work and they can't really take criticism well. That's something to know. Communicating in an appropriate way for a given environment. Maybe self-organization is difficult. Or planning ahead, schedules, making sure that the job gets done over a period of time, making that planning happen. Maybe enduring hardships in the workplace, too much drama, too much change going on in the workplace. That's difficult. It's difficult for anybody. Knowing how to navigate a work environment and managing stressful interpersonal interactions. So those are all pieces of developing a work ethic, core components. And so it's really important to keep those in mind as we're helping people navigate the employment process. So let's just take a minute, and you don't have to share this with me if you don't want to, but I want us just to think about for a second, how did you develop your work ethic? Can you think of somebody who was integral in your life that you observed? Family, social environments, interactions, maybe something at work or something in an educational background? Oh, and Phoebe says the military. That's great. Rob says family. Great. And so that's how you develop your work ethic, right? Watching your parents and grandparents. Good. Thank you, Carolyn. Family and teachers. Thank you. Very good. So it's evident, that we've learned how to work based on what we've observed. And so who are the people in your life that modeled that behavior? What does work ethic mean to me? And does the mental health system lead to the development of a healthy work ethic? And if we're talking about our programs, does my program help someone develop a healthy work ethic? And how can I incorporate these values into my day-to-day for those people that I support with employment? So thinking about where your work ethic came from is first and foremost. And then thinking about if the individual I'm working with has never worked before, thinking about where they learned a work ethic. Who were their mentors? Who did they observe? How did they get their knowledge? And when they go to work, are they going to have a good work ethic or a poor work ethic? And how can you and your program help them develop a good work ethic so that they can be successful? They can have an positive outcome, positive employment outcome. When we think about work ethic, we should also consider our preparation for work. So thinking about how you get ready for work, when does that actually start for you? And thinking about all the small steps it takes and our habits that we often take for granted. So perhaps the night before your preparation includes setting out your clothes or making your lunch for the next day or getting sleep or mentally preparing for what the day will look like tomorrow. Maybe it's helping your kids pack their lunch or finish their homework or getting them to lay out their clothes, helping them set up for their next day. And maybe the morning prep is transportation, making sure that you have transportation to get to and from work. And maybe you're at the bus stop at the exact time so that you can catch the bus. But then navigating challenges that could derail a plan and having backups in place. You know, maybe school is closed for extremely cold weather, like here in New York. And so you don't have a babysitter all of a sudden. And so having a backup plan so that you can still go to work while your child is still being taken care of. So thinking about those things, those are also work ethic elements, developing a work ethic. So I put together a couple of work ethic examples. So let's say Sam and Jesse bump into each other at the water fountain and they catch up on their weekend plans. And Jesse says that he's going to duck out early so he can get his weekend started. And Sam knows that Jesse didn't request the time off. So a person with a good work ethic might say, Sam's going to encourage Jesse to request the time off and follow the specific work policies that are in place. But a poor work ethic might say, oh, so if Jesse can get away with that, then I'm going to try that too. And after all, what's the worst thing that could happen? So thinking about work ethic in that regard, you know, how we respond to someone's situation can also determine what our work ethic is as well. If we, you know, which road we take could also determine that. Another example might be that they're in the kitchen preparing for lunch. And Jesse shares with Sam that over the weekend he saw a coworker at the grocery store, but she was with somebody other than her significant other. And so he speculates that this person is having an affair. So someone with a good work ethic might shut down the gossip immediately and say that it's just not appropriate to start rumors about this person. But somebody with a poor work ethic might chuckle and encourage more information about what this coworker is doing. So it's important to think about our interactions at work too, right? So how we respond to somebody else, but also what happens when we see this coworker out of the grocery. If we were the one who brought up the gossip stuff, you know, that's not an example of a good work ethic. So we have to kind of consider all of the scenarios that we find ourselves in, and we make choices like thousands, hundreds of thousands of choices every day. And how we respond, how we choose to respond to something says a lot about our work ethic. So when we think about a good work ethic, we want to consider several categories. So we want to look at reliability and dependability. And that means being at work on time, going to work at your appointed schedule every day, making sure that you are dependable. Somebody asks you to do something, you always follow through with it and you make sure that it happens. You say you're going to do it, you're going to do it and follow through. When we also encourage people about going to work who maybe have limited experience at work, we want to stress like the attendance issue. I have, in the past, I have worked with coworkers who arrive at 8 o'clock and then they go get their coffee and then they chat with coworkers and then they get back to their desk about 8:30, 9 o'clock. And so that's not necessarily an example of a good work ethic. So if you're supposed to be at work at 8 o'clock, you should be at work at 8 o'clock and get ready to start your day. Productivity is another thing that's really important. And it's about the amount of work that you can get done during your day or your shift. It doesn't mean that a person has to work themselves to death to be an overproducer, but it does mean that they are concentrating on doing the job that they were hired to do and completing their tasks or making progress on those tasks. So it's important. Productivity is important. Again, you don't have to kill yourself to get it done, but making sure that there is progress happening. Another important concept of a good work ethic is ownership and autonomy. And that primarily, it means taking ownership for things that you do. If you make a mistake, it's okay to acknowledge that you were the one who made the mistake. Autonomy is about, being independent, doing things on your own, but also being able to collaborate as a team member. So it's important both ways, but being able to do your job without someone holding your hand while you do it, and taking ownership for those things that you do. Things that are great, being able to say that you did that, but also acknowledging if somebody helped or taking ownership if you've made a mistake. That's really important. In addition, I mentioned collaboration and team support. So working together as a team, and I don't know if any of you have had the experience of working in a group. Sometimes it is not the most productive to work in a group setting or collaboration, but it's important to know that as you do that, that maybe you identify specific tasks each individual in the group is going to do, and then you're responsible for your portion of it and making sure that that gets done. That's your piece of that big picture. But collaborating, maybe you're working on a project all by yourself and you have some questions and you're not sure who to go to. So you would go to your supervisor or your team leader and kind of talk about things and then figure out how to make it work. So collaboration is just as important as working independently. And it's really important in this day and age to be able to do both back and forth, be flexible amongst working independently and working in a team. So we talked about the good work qualities. So let's talk a little bit about poor work ethic qualities. So low work quality, maybe handing something in that you didn't review first. Maybe there's a lot of spelling errors or formatting errors or something is not correct with it. So producing low work quality, just turning it in, hurrying through it and turn it in. That's not a very good work ethic. Consistent tardiness. Sometimes we're tardy because there's too much traffic on the highway or there's an accident and we can't get around it. So there are some times when people are tardy for work, but a consistent tardiness shows a lack of ability to get there to work on time, which is a poor work quality. Lack of attention to detail, and we talked about that perhaps with turning in something that you hadn't reviewed before it was due. Focusing on your goals at the expense of the greater team or company goals. So making sure that your stuff gets done, but something that you're doing for someone else does not get done, or yours is first, instead of looking at the team as a whole. And then abuse or harassment, whether it's explicit, unconscious, microaggressions, or sabotaging of others, setting somebody up to fail. That's a definite poor quality for a work ethic. Any questions about the developing a work ethic or how to help someone also develop a work ethic? Let's see, I'm in the chat. Let's take a look here. There was a note that the work ethic came from mentors and workshops. Great suggestion is workshops and learning how to dress, for example, Dress for Success programs. Yep, that's a great resource. Okay, anything else about ethics, work ethic, developing a work ethic or helping someone else do that? Okay. So the next thing we should talk about is something called benefits basics. And it's just going to be kind of a high level about benefits, but I think it's really important for you to have some understanding. And again, you don't have to be an expert. You are not the person who has to be the expert. If you do want to pursue certified benefits advisement, I can give you some resources for that as well. But let's talk about benefits for a second. So SSI and SSDI are separate Social Security benefit types, and they calculate wages in very different ways. But in either case, working is still a good idea for somebody on benefits. And there's my commercial again, always consult a certified benefits advisor. Wages must be reported in all scenarios to prevent overpayments or related penalties. Now, it is entirely possible that somebody could get an overpayment, but if they are with a certified benefits advisor, they may be able to help navigate that process for the individual, and in some cases get a waiver so that there is no overpayment in place. So it's really important to connect with somebody who can help with that process. In addition, if the individual earns enough for cash benefits to stop, there are multiple ways to continue receiving free Medicaid. And we mentioned that before, 1619B, which is an automatic process from Social Security. They will see that you're earning more money in SSI benefits and automatically switch over to the 1619B program. That still allows that individual to keep their Medicaid coverage. In addition, there is a program called the Medicaid Buy-in for working people with disabilities. And this is not an automatic process. So the individual actually has to apply for this particular benefit, Medicaid Buy-in. And it says Medicaid Buy-in, and right now there is no premium. You don't have to pay to buy into the insurance. In future months, there may be, depending on a person's income, but that, I don't know that information right now. There are also a couple of ways that people can save money, even if they're on benefits, so that they're not going to impact their benefit type. So for example, there's one called Achieving a Better Life Experience, which is an ABLE account. And an ABLE account is like a savings account, or you can have a savings account, a checking account, and then there's an investment option as well. But it's like putting money into an account to hold on to it, but it does not impact the resource limit for SSI benefits. So it's really important to know about that. In addition, there's a plan to achieve self-support. It's called a PASS plan. And it's for anybody who is on SSI or SSDI, and they want to save money for a specific thing, a goal for them for work. So for example, if I'm going to go to work and I have to take the bus to work, maybe I want to put $50 of my income in a PASS plan each month, and in 2 years, I'm going to buy a car, or 4 years, whatever it might be. But anyway, I'm going to buy a car so I can go to work. And so that's a PASS plan, and it has to be approved through Social Security, but there are a lot of options available. Maybe somebody is going to school and they need computer equipment, and so they can save for that computer equipment without that impacting their benefits. So it's really important to know about those two savings programs because they could benefit a lot of people. So let's talk just a little bit about SSI benefits. So SSI stands for Supplemental Security Income. And this program provides a cash benefit payment to people who have limited income and limited resources. And the resource limits, and they should change annually, but they haven't changed in a really long time. We keep hoping that this number will go up, but it has not yet. But a single individual can have resources of $2,000. Now that means anything that can be turned into cash. So it could be your checking account money, savings account funds, retirement funds. It does not count a house if you own a home, or a vehicle if you own your own vehicle. A person with a spouse, they can have resources up to $3,000. So again, that's not very much money, right? And Social Security begins with what's called a federal benefit rate. And in 2025, that figure is $967. So if you're getting SSI of $967 and you have $2,000 in savings, that is the maximum that you can have. And that's not a lot of money these days. So it's really important to think about ways that maybe you can save money, like the ABLE account or the PASS plan, so that it would not impact that resource limit. Again, that's another thing that a certified benefits advisor can help with, but I want to just mention it here. Social Security starts with the 967, and then they consider unearned income, which might be something like child support payments, and earned income, which is the money that person earns from going to work, their wages. And then they also consider work incentives. So there are a number of work incentives that are available based on your benefit type. So if you're getting SSI benefits, there's a list of work incentives you can possibly use. If you're getting SSDI, there's another list of work incentives that you might be able to use. So based on SSI, they're looking at unearned, earned income, and then they would subtract any of the work incentive money to lower the countable income, which then helps you maintain more of your SSI cash benefit. And I know that's a lot of information and it's probably confusing. So if you have additional questions about that, please feel free to reach out. A general rule of thumb for SSI is that for every $2 a person earns in earned income, they will lose $1 of their SSI cash benefit. Now, that is not a hard and fast rule because there are several work incentives that can help a person maintain that benefit longer. And we want to talk about those. So there's the student earned income exclusion, the impairment related work expense, also known as an IRWE. You might have heard it that way before. There's the blind work expense and a subsidy special condition. Okay, so let me talk about these just for a minute. The student earned income exclusion is available to individuals who are under the age of 22. They are working and they are going to school. And there's a certain amount of money that they can work and earn and tell Social Security, hey, I want to use the student earned income exclusion, and they will remove that amount from their calculation in determining how much of a Social Security benefit you get. So that allows you to work, go to school, maintain that income, and your SSI benefit check. So that's really helpful, and it's a great program for people, but they're only for people under the age of 22. The impairment-related work expenses are expenses that a person needs in order to go to work related to their disability that are not being paid by anybody else. So if you go to the doctor and you're paying your copayment to the doctor and somebody reimburses you that copayment, that is not an IRWE expense. But if you pay $25 at your doctor's appointment and nobody's reimbursing you for that, that could be considered an IRWE expense. So Social Security requires that you complete a form that has all of your expenses and what they were for and the amount of money and receipts that you paid for them. And then they can go through and determine whether or not the IRWE expense can be included. And if it's accepted and included, then Social Security can remove however much money you spent that month from the countable income, which then increases your, or not increases, but helps you maintain your SSI benefit longer. The blind work expense is just like the impairment related work expense, except that an individual who is blind, who is going to claim the blind work expense, does not have to be related to their blindness. So their diagnosis is blindness, but the expense that they're using for the IRWI expense does not have to be related to that blindness. Can be anything, it is. Subsidy and special conditions. So that is an area where a person is going to work and they are working the same job that somebody else is, and they're getting the same pay for it. Only they may not have as high a production requirement as the person next to them. Special condition might mean that there is a job coach coming in to help that person do part of their job. And in those two scenarios, the employer would write information about what the subsidy is, or the individual would talk about their job coach doing 50% of their job for a period of time. And Social Security takes that into consideration when they're figuring out how much SSI benefit check that person will receive. So it's those are great benefits for people. I did see a question pop up about impairment related work expense, and I just saw the tail end of it. So let me know if I get this right. But there are a lot of different things that fall under the IRWI expenses. So it can be co-payments for medications, for doctor's appointments, for prosthetics. It can be for a personal attendant coming to school with you or coming to work, helping out in that way. There's a long list of things. It could even be transportation in some circumstances. So there's a lot of different things that can cover. So it's absolutely worth checking into. Okay. Let's see. Was there anything else in the chat about? Yes, there will be. You will get a copy of the slides. Oh, there was a. Let's see. What's it saying? Staff and attitudes with work ethics. So absolutely, Cheryl. Our attitudes at work can also impact other people's work ethics as well, but our staff and our attitudes mirror our work ethic at work. So it's really important. Trust fund impacts someone's benefits, and that is a great question that I'm not sure that I have the answer to. It is possible that it could impact a benefit if that person is withdrawing funds from a trust fund that would go toward their resource limit. So yes, I'm inclined to think yes, that will be impactful. If the trust fund can be set up into an ABLE account, an individual can add up to $19,000 a year in an ABLE account without it impacting someone's benefits. So that would be a great resource. And then prescription copays, yes. Okay. So let's talk about SSDI benefits. SSDI stands for Social Security Disability Insurance. And this benefit type is for people who have paid into the Social Security program as they've worked over the years. And the amount that they receive is based on their earnings. So initially, a person has to work and pay into the disability insurance program before they're eligible for SSDI benefits. And a person, and I'm just going to talk in general, an adult person has to earn 40 work credits. And that means you can earn 4 work credits per year. Over a 10-year period, you would get up to 40 credits then and be eligible at that point. Now, I say just an average adult because there are exceptions to this rule based on a person's age and disability types. So right now, I'm just talking about an average adult. An individual can earn 1 work credit per quarter, and there's a certain amount of money they have to earn each quarter in order to make that 1 work credit. And then they're working over 10 years would allow them to be eligible for SSDI benefits. So Social Security does have specific work incentives associated with SSDI benefits. And one is the impairment related work expense. So that's exactly the same as the SSI work incentive. They work exactly the same. There are the same rules and exceptions to those rules as well. They're all the same. The trial work period allows an individual to maintain their SSDI benefit and work. And during this 9-month trial work period, they can work and earn as much as they want to. Oftentimes people say they can earn Bill Gates money. So hopefully all of you know who Bill Gates is. He makes a lot of money a month. So this would allow somebody to work and earn as much as they want and still keep their benefit. It is only a 9-month period. So if they go over a certain amount of money, after that 9-month period, that is a different story. Let's see how I can explain this. The 9 months, if a person earns over what's called trial work level, then that month counts as the first trial work month. If next month they've worked under that trial work level, that second month doesn't count. So it doesn't have to be consecutive 9 months. It can go up and down based on their income. But once that period is over, once 9 months have passed, the extended period of eligibility kicks in. And this is based on what's called substantial gainful activity. And Social Security put together that phrase to indicate somebody who can go to work and earn a substantial income. And so if they go over that amount, Social Security will start the termination process of benefits during this extended period of eligibility. It's a 36-month period. And if they go over that amount, that SGA amount, they start the termination process. It's called the cessation month. And then they allow 2 grace period months. And then the benefits stop. But if during this extended period of eligibility, they fall below that SGA level, they are able to get their disability payment back. So it's a process. Then there's something called the expedited reinstatement. And this is a period of time where, let's say an individual has gone to work and they've been successfully employed and they were terminated from their benefits, but they're making a good income, everything's great. And then within 5 years of the termination of their benefits, something happens. Maybe they are hospitalized for a period of time and they fall below that trial work and that SGA level. And so they can go to Social Security and ask them for an expedited reinstatement of their benefits. And Social Security has 6 months to determine whether or not they're still eligible for that benefit. And if they are, then they can continue to get their benefits. If they're not, they may be asked to reapply for benefits. The happy thing during this period of time is if they are asking for an expedited reinstatement, they can ask for their payment during the process of being reviewed. And so that's good for people to be able to get their benefit check while Social Security is determining whether or not eligibility will happen for them. And they don't have to repay that. So if Social Security ultimately says, no, you're no longer entitled to that benefit, then you can still keep that money. You don't have to give that back to Social Security. So that's good. There may be times when Social Security says, no, you're not entitled to that benefit back. And so part of the reason for that might be under the original disability, those symptoms got better. Maybe you don't have the same barriers to employment that you had previously, or maybe you've been diagnosed with something else that is primary at this point. And so you would reapply for benefits based on the new disability diagnosis. There are a lot of different scenarios involved in that, but these are work incentives that can be very helpful for people to try to go to work and see how it works for them. And there are safety nets in place. You might call the work incentives a safety net to be able to help them get back up on their feet and maybe get benefits again if they need them. One of the other concerns about going back to work is healthcare, losing healthcare benefits. And we already talked about these a little bit. But if your cash benefits stop, you can still receive free Medicaid in most cases. We talked about 1619B. There's a certain amount of money that you can earn in 2025. Currently, it's about $73,000 for an individual person. And it's an automatic process through Social Security. They will pick that up, recognize you're earning more money, you're going to lose your benefit, but you can still maintain your Medicaid coverage. The Medicaid buy-in program is being updated for 2025. And right now it has not been fully gone through the process. So it's not fully approved yet, but they have the potential this year to be able to make up to $320,000 a year and still receive Medicaid coverage. That individual does have to apply for the coverage, and it's not an automatic process. And the thing about the Medicaid buy-in for working people with disabilities, as I mentioned, right now there's not a premium, but if an individual is earning over $300,000, there may be a premium for them to buy into the program. We just don't have all the details of that yet. Okay, let's stop here for a second. Okay, the question in the chat is, does the child of SSDI recipient is eligible for benefits too? So there are some scenarios, yes. If an individual who's receiving SSI or SSDI and they pass away, that the adult, their child may be eligible for disability benefits as well. There's also a clause in there somewhere about a person who is retired, also disabled, and then being able to get childhood disability benefits as well. So there's a lot of scenarios in place. This presentation really focuses just on adults, but there are special rules for children. Okay. So this next section, let's see, EPA before all benefits are potentially lost. Okay, I'm going to try to understand that. Let me stop so I can reread that question. What would be the longest allotted time period for trial work period, extended period of eligibility before all benefits are potentially lost? I misunderstood if trial work period was for 9 months and the EPA is 36 months. Yes, so the trial work period is 9 months long and the extended period of eligibility is 36 months. During the trial work period, the individual, those are not consecutive months. So they could be, yes, they're using 1 month and no, the next month is not being used. And maybe they go 6 months without one being used and then the next one is. So potentially it could be a very long time. 36 months for EPA, or I'm sorry, EPE, and the 9 months can be, you know, not consecutive. So it could extend for a period of time. But once in the EPE, they have reached SGA, they've gone over the SGA level, or they've reached the SGA level, then the termination is called the cessation month. And then there are 2 grace period months. So if the person is not earning SGA level through the EPE, it could go that full 36 months. So it kind of depends on which months are being used for trial work period and if they're going over SGA or trial work level. Good question. Let's see. If someone wants to get employed. Okay. So yeah, if let's say I get employed and I have SSDI benefits and I have 9 months of trial work period, so I can make Bill Gates money and have 9 months still getting my disability check. But then at the end of that 9 months, I'm now working over SGA because I'm still making Bill Gates money. Then I have 3 months and then my benefits are terminated. So it could be 9, 10, 11, 12 months. But if I'm working Bill Gates money in the trial work period, 9 months, and then I am in the 36-month period, but I don't earn that much money anymore. I stopped earning that much money, and now I'm under SGA level. I could still have SGA level. I'm sorry, I could still have my disability benefits for 36 months. There's just all kinds of different scenarios, I guess. Yes. Okay, terrific. Thank you. It's kind of based on an individual basis. It depends on what that person is earning and where they're at in those work incentives. Okay, so let's talk about wage reporting and overpayment. So people that you're working with are going to work and they're going to earn some wages. And if they are receiving SSA benefits, so either SSI or SSDI, then they are required to report their wages within the first 6 days of the calendar month for the income that they earned the previous. So if I earned my wages in January, then by February 6th, I have to report those wages to Social Security. And there are several ways that a person can do this. So they can create a free online Social Security account, and there's a reporting tool within to report SSI or SSDI. There's a mobile app that SSI beneficiaries can download their wage reporting app on their smartphone and then allow you to report your wages. You can also do telephone wage reporting, report their monthly wages over the phone, and your local Social Security field office. So you could go to their office, ask them to make copies, or you could you could you could mail in snail mail to that field office those wages. Now, if you're going to do that, if you're going to snail mail those wages, then you probably want to do certified mail, which does have a cost for people, which is a concern. But that way, somebody has to sign for them that they've received them. Now, the other thing about wage reporting, that anytime a person reports their wages, it's really important for them to get a confirmation number. If they've reported their wages and they have a confirmation number, then they can prove that they reported their wages. What I often recommend, and it's not always possible for people, but I would have a notebook that has any information from Social Security in it. And if you're going to report your wages in February for January, I would have a copy of that in this notebook with the confirmation number attached, so that if you ever have to prove that wages were reported, you can go right to a notebook, pull it out, and submit it to Social Security. So it depends on a person's ability to be able to do that, but maybe you can help somebody set that system up. The other thing that sometimes happens is one of the people you're working with has been notified from Social Security that they have an overpayment. Now, there's a couple of things. Anytime anybody gets a letter, an envelope from Social Security, people are really reluctant to open it. It's usually bad news, right? That's what people think. So they might throw it in a drawer and never look at it. But the problem with that is if there is something happened, like an overpayment, and you have 15 days to file an appeal process, if you don't open that letter, you're going to miss the appeal process and then have to, do the overpayment process. So it's really important to encourage people to open the mail. And you might then stick it in that notebook that I just suggested, so that every piece of information that you have from Social Security is in the same place, which is really important. But there are some options with overpayments, and I just wanted to mention this. There has been some suggestion recently from Social Security that they are not going to as aggressively try to get overpayments returned. So that's a benefit for people, that they're not going to try to aggressively do that. In addition, if a person can prove that they have submitted their wages and they have those confirmation numbers, then they're going to look at fault. Maybe it's not that individual's fault, it's Social Security's fault. And so they may not have the overpayment because they can prove that they already submitted those wages. And then another suggestion might be that the individual not spend the money. So if they know that they're going to work and they know they're earning more money than what their benefit check will allow, they may, hold on to it. And if you put it in a checking account or savings account, there may be additional issues. But hanging on to the money instead of spending it, because the following month or the next month that it comes up, Social Security is going to want that money back. And if you have it to give back, then that's a benefit for that person. They don't have to come up with it. Also suggesting a certified benefits advisor who can help navigate the process. Sometimes that person can help with a waiver, and the waiver can then eliminate the overpayment altogether. Sometimes they can navigate that money down. So maybe it's a $30,000 overpayment, and maybe they'll make it $15,000, and maybe that person can take $20 a week or a month out of their check, or $30 a month, whatever you want to navigate down. So that's really important, I think, is connecting with a benefits advisor who can help manage that process. And they know how to do that, the waiver system or negotiating with Social Security about those things. And there is a process in place to appeal an overpayment. Again, you might only get 15 days to appeal. So it's really important to stay on top of that and be connected with a benefits advisor before that process happens, so that that person can just step in and help instead of trying to get connected to somebody. Okay, and there was a question. Let's see. Okay, how long should the monthly reported wages be kept? And that is a great question, because the size of the notebook is going to get full, right? And so you may not have enough room to keep everything for 10 years. Social Security can go back and do overpayments from past income as well. So we want to hang on to it as long as you can. Pat recommends or mentions 7 years. And I would say that's a good starting point. I would say at least 7 years worth of wages. Yeah, I think that's a good starting point. Great point, Pat. Thank you. Okay, so we are at the end of the presentation and we're in the resources section. So the following resources can be used by an individual and or OMH Housing to help the individual gain information that they need in order to make informed decisions about going to work. So I want to highlight some of these. It's really important to know up front that we welcome you, the staff person, to any of these resources, but we also welcome any of the people you're working with to use them as well. So feel free to share any of these resources with anybody you deem necessary. So our website, again, is nice.ny.gov. And I have highlighted here the customer resources tab, and that is where you will find the benefits information. So that could be information for the customer to talk about benefits in general. And then there's the Ticket to Work website, which is choosework.ssa.gov. And this is the official Ticket to Work website. So any information that you have about or need about Ticket to Work or work incentives or benefits, that is a great place to go. In addition, I wanted to mention the Ticket to Work called Work Incentive Seminar Events. They're called WISE webinars. They are offered on a monthly basis, and the registration link is there. They are no cost, and they're designed for people who are beneficiaries of Social Security, but anybody can attend them. So if you want to attend by yourself, if you want to attend with people you're serving, absolutely do that. They're no cost. They happen on a monthly basis. The last one was yesterday, so it was Wednesday evening, and it was about, like the first half of the program talks about Ticket to Work and how your benefits might be impacted when you go to work. But the last half of the webinar is about a specific topic. So yesterday's was about mental health and going to work and how that works together. So those are really terrific webinars. And again, they're free to anybody who wants to attend them. Okay, do you have any questions? My contact information is on this last slide. It's also on the first slide. If you'd like to reach out, please email me at lisa.brown2@omh.ny.gov, or you're welcome to give me a call at 518-474-3358.